And they're called COVID long haulers, people who get coronavirus and survive but don't recover quickly or at all.
News 5's Olivia Fecto tells us about a Northeast Ohio woman, Courtney, who says she's been dealing with this virus now for 6 months.
For the last 2 years, Isabela Pauer has been living in Barcelona. The 22-year-old was healthy, but she started feeling sick about 6 months ago after a friend tested positive for COVID-19.
Like all my friends, we had been with her like every single day, so I had assumed I was going to get it.
She wasn't too worried since at the time the focus was mostly on how the virus affected older people. But then came weeks of persistent chest pain, breathing problems, headaches, and nausea.
I was really starting to freak out and I ended up going to the hospital.
Pauer says doctors in Spain didn't think it could be COVID since she'd already been sick for weeks. Plus, they said she was young. They didn't test her, but she got worse.
Every year that's passed by and I got sick, I would go to the doctor, go to the hospital. They would give me medicine and help me. But this was different. This is different. Like, no one really knows what's going on.
An online support group offered her hope, with thousands of other people going through the same thing. Back in Northeast Ohio for several weeks now, Pauer is still dealing with pain, a big change for someone who was healthy before this.
Now I can barely go and brush my teeth in the morning because sometimes I just get really exhausted with the hand movement. Taking a shower is really, really scary for me because I've fainted 3 times.
Pauer is seeing doctors in the Cleveland area, including Dr. Anjali Maru, an interventional cardiologist.
It's not one area in particular. She has symptoms coming from her entire body, and they are all interconnected.
Maru has seen this with many other patients who describe an illness that clinically sounds a lot like COVID, but who may have had trouble getting tested in the first few months of 2020. She says they experience chronic fatigue, brain fog, gastrointestinal symptoms, even blood clots and strokes.
It is scary as a doctor, a nurse, or any healthcare provider to not be able to reassure someone that you know exactly how to help them.
Pauer tested negative twice this past weekend, which Dr. Maru says isn't uncommon in patients who recovered from COVID.
We've been seeing that in people who are 4, 5, 6 weeks out, where tests turn positive, then turn negative, then turn positive.
As a COVID long hauler, Pauer is worried about other young people and kids. She says she's an example of what can happen to those who get the virus and don't recover quickly.
I hope that a lot of people really change their mindset about this and take it more seriously.
Olivia Fecto, News 5.